Thanks, Brooke. It's a painful reality nearly 25% of women and 18% of men suffer from varicose veins. But seeing the bulging veins isn't the only problem. Dr. Carl Black from Intermountain Veins says if left untreated, this medical condition can only get more serious. And joining him is Jessica Madsen, a vein center patient who recently had her varicose veins treated. First of all, Dr. Black, how does someone know if they're a good candidate for this treatment?
Well, there's a spectrum of presentations, and that can range from just a bulging varicosity on the leg to actually having swelling. And in some extreme cases, your skin actually starts to change color. If you leave that untreated, it can go on towards even ulcerations in the skin. So it's a severe condition.
These are exactly some of the symptoms you were talking about there that we can see. Jessica, I have to ask you, what kind of symptoms did you see? How did you know it was time for you to get some help here?
Well, I had a lot of the symptoms that Dr. Black is describing. I had a lot of pain in my legs, and I had some bulging in my legs, and then I did start getting some of the discoloration. So my legs started to turn kind of different colors, purples and blacks and blues, and they weren't very pretty anymore.
So you could see it literally on the outside. You knew that there was a problem with that, right?
Was a problem, yeah.
Is that, Dr. Black, is that always the situation? Even if you can't see something on the outside, is there a sign there could be something else going on inside?
That's a great question, because if someone's leg aches, they could attribute it to maybe back pain or a pinched nerve. In reality, it could be underlying venous disease. So you don't always have to see something to have vein disease.
So what we see on the left, I think, is what we typically think of with varicose veins. And can people actually literally get to the picture on the right there with that?
Oh yeah, routinely. That's not an unusual event for us at all.
What's the difference then between a good vein and a bad vein? What do you do?
It really boils down to what's going on with the valve. Inside of your vein, you have a one-way valve that allows blood to flow back to the heart, but prevents it from pooling at your legs. If those valves become damaged, then blood basically can pool with high pressure down around the ankles, and that's where it affects your circulation. That's what this really is. It's about preserving healthy circulation, and the tissue ironically becomes starved of oxygen, and you start to develop all the complications. It can be blood clots, it could be changes in skin coloration, maybe even ulceration.
What do you do then? What's the procedure to fix this?
The procedure is it's very important that you identify what's going on. Every patient's different, and so diagnosis is everything. We take a lot of care in making sure that we understand someone's anatomy. We use ultrasound, and we figure out which veins are causing the problem, and then selectively treat those either using radiofrequency energy or laser energy. And typically a procedure takes about an hour. Often patients, depending on their severity, may need more than one procedure.
Jessica, I'm excited to talk to you now. What did this procedure do to you? How did this change your life?
Oh, it's made all the difference in the world for me. I'm a runner. I love to run, and I have 3 little girls that I'm trying to keep up with all the time. Yeah. And, you know, I got to the point where I couldn't even walk anymore, and my legs were just tired and achy, and they hurt all the time. And this has given me my life back. I can now run with no pain. My muscles heal better, and I'm not embarrassed to wear shorts anymore, which makes all the difference in the world when you have little girls that you're out with all the time. So.
Well, you were suffering with this, having pain. Did you ever think that you could get to the point where you are now and you're able to run and do that stuff?
Absolutely not.
Wow.
Absolutely not. I didn't realize how much help was out there. I didn't realize you know, that I was even a good candidate for any of it. I just thought that I was stuck with them for the rest of my life.
Dr. Black, you have a special event coming up, right?
Yeah, we have our Mother's Day screening event. It's a time to give back to your mom, because often having kids makes this worse, so we thought what better event than Mother's Day to have a screening. And if you or a loved one suffer or potentially have varicose vein disease, come to our event. It's on May 4th at Provo Library from 10 to 3 p.m. and we'll have doctors there. We'll be doing a free screening and just be able to assess people for potential vein disease.
The website ivein.com if you'd like more information. Jessica, thanks for sharing your story. And
Thank you.
Black, thanks for letting us know about this.
Thanks for having us.
We'll be back with more in Studio 5 right after this.